2, 3. Carl, does that sound good?
Good morning. My name is Rob Cowie. I'm the Communications Director of the Oregon Health Authority. Thank you for coming this morning. Today, state and local officials are announcing new measures to combat the spread of COVID-19 in Oregon. Speaking today will be Governor Kate Brown, Multnomah County Chair Deborah Kafori, Portland Mayor Ted Wheeler, Oregon Health Authority State Health Officer Dr. Dean Seidlinger, and Tri-County Health Officer Dr. Jennifer Vines. After our state and local officials have concluded the remarks, there'll be an opportunity for you to ask questions. And now let me turn it over to Governor Kate Brown.
Thank you, Rob. Good morning, everyone. Thank you so much for being here this morning. We find ourselves in an unprecedented public health crisis, a rapidly evolving global pandemic. Most of us have never experienced anything like this. What is clear today is that we must take immediate action to stem the spread of COVID-19 coronavirus in our communities. Our strategy now in Oregon is shifting away from one of containing isolated cases of COVID-19. Now we are focused on preventing the worst impacts of a mass outbreak from coming to pass. We must act now to protect those who are most vulnerable, our elderly, those with underlying health conditions. We need to focus on keeping them safe by ensuring that our healthcare system has the capacity to treat those hardest hit by the disease. Earlier this week, the Centers for Disease Control issued updated guidance. They gave recommendations on large gatherings, social distancing, workplace practices, and other community-wide mitigation efforts that can help slow the transmission of the virus. Throughout this crisis, my office has been consulting with the Oregon Health Authority, local public health, and other state and local agencies on the best policies to slow the spread of COVID-19. Yesterday, we announced a variety of steps for Oregonians to take to decrease risks and protect each other. The following measures are based on the recommendations of the CDC, Oregon public health experts, epidemiologists, and health professionals to prevent a widespread outbreak of COVID-19. Effective immediately, all large gatherings in the state of Oregon, over 250 people, will be canceled for 4 weeks until April 8th. We have also issued numerous other guidelines for events to keep attendees safe. I want to clarify that this guidance applies to organized events, but does not apply to other places where other large numbers of people gather, such as stores, shopping centers, or schools. Building on the school guidance my administration released earlier this week that all schools stay open, we are adding guidelines that virtually all school group activities and gatherings should be canceled, including field trips, parent meetings, and competitions. These measures have been recommended by public health experts. Considerations of school closures will be a last resort. Using CDC guidelines as a base, we have issued detailed recommendations for workplaces to immediately implement social distancing measures to protect employees. That includes increased physical space, limited travel and in-person meetings, and staggered work schedules. Long-term care and assisted living facilities should strictly adhere to the guidance issued by the Oregon Health Authority and Department of Human Services earlier this week to protect residents. Let me be clear, coronavirus is in our communities. We should be prepared for thousands of cases in Oregon. These actions I'm taking today have two main goals: to slow the transmission of the disease and to preserve hospital capacity for those who will need it the most. My first order of business is to protect the health of Oregonians. My second order, to secure their jobs. I will be pulling together a group of business representatives to devise a plan for how businesses, especially our small businesses, will ride this out. Make no mistake, these efforts to fight coronavirus will have an impact on our daily lives, our livelihoods, and Oregon's economy. It will be especially difficult for Oregonians without the means to miss work or self-quarantine if necessary. But these steps can help save lives. That is what is at stake. This disease does not discriminate. We are all facing this together. My commitment to you today is that I will do everything in my power to keep Oregon families healthy and safe. I'll now turn it over to Chair Kafoury. She's been a fantastic partner in this work, and I appreciate her close collaboration.
Thank you, Governor. Good morning. Yesterday, the World Health Organization declared COVID-19 a pandemic. But as all of us know, disasters are local. So I need you to know that even before this new coronavirus was named, or barely in the United States, Multnomah County stood up our emergency operations response. We knew that we had to test, track, report, and support the people who will be touched by this virus, because we know our community. We're beside them as they look for work, celebrate recovery, start a family, or get their first library card. And we're there when the crisis hits. We know that the metro area is particularly vulnerable to a virus that feeds on people coming together. Because people come together here. We have the restaurants, the clubs, the concert halls, and we have the largest and the most popular venues. We have the largest airport and the Port of Portland. We also have the largest number of unsheltered people in the state, the largest number of shelters in the state. And we know that these neighbors are particularly at risk because they are older and sicker than the rest of the population. So we've been running hard to respond. When called upon by OHA, we launched a drive-through testing clinic like they did in South Korea to quickly and safely test those who were prospective cases. We have tracked dozens of contacts, advised hundreds of callers, and met with community partners to develop reams of guidance. Over the past month, more than 100 Multnomah County employees and subject matter experts have taken shifts in our emergency operations center. And that was all before we had a single case. On Tuesday, we had our first presumed positive test result in Multnomah County. And on Wednesday, I declared a state of emergency. Multnomah County's declaration of emergency gives us the flexibility to sustain what we're doing now and face what may come in this unprecedented outbreak. What we're doing now is regularly convening and advising providers and residents of every manner of shelter. Outreach workers are fanning out, getting necessary supplies to our neighbors on the street, blankets, tarps, hygiene supplies, and information cards with guidance. And we're keeping our winter shelter beds open and increasing motel vouchers to limit overcrowding. Together, Mayor Ted Wheeler and I have committed additional resources to keep as many people as healthy as possible for as long as possible. But we can't protect our community without the partnership of our stakeholders. I want to specifically thank the more than 150 school superintendents, directors of nonprofits, businesses, the arts, hospitality, and many more who joined community listening sessions with myself and Dr. Jennifer Vines yesterday. Hard to believe that that was only yesterday. That input and engagement is incredibly valuable. We also cannot be successful without our partnership with Washington and Clackamas counties and the state of Oregon. The actions that the governor described today are our best chance to do what Dr. Vines calls flattening the curve, slowing the rate at which people are exposed and potentially become ill. Because we know that a surge of cases could quickly overwhelm even our extremely capable health partners. Governor Brown has given us a roadmap to navigate this unknown landscape and help us know how, in the weeks ahead, we can connect in different ways. And like leaders in many organizations, I'll be trying to figure out how to get vital work done to keep our clinics open to keep serving veterans and older adults and to still be Multnomah County in the face of such a threat. Thank you. And now I'd like to welcome, first I would like to call out some of our partners that are here today. We have Dr. Sharon Myron, Sushila Jayapal, Senator Lou Frederick, Commissioner Jessica Vega Peterson, Commissioner Lori Stegman, Gresham Mayor Shane Bemis, the Superintendent Guadalupe Guillermo, and Governor. Thank you.
Thank you, and I want to thank Governor Brown and Chair Kafori for their leadership during this time. After much thought and consideration and discussions with our county and state partners, this morning I declared a state of emergency on behalf of the City of Portland. This is a decision I don't take lightly, given the broad implications. But due to COVID-19's progression on the West Coast, I believe that it's in the best interest of public health to declare a state of emergency at this time. It gives the city additional authority to properly address the threat of infection and harm. It also gives us the tools that we need to support the county, the state, and our own city employees. I know you have a lot of questions on how we plan on exercising these emergency powers. We'll keep you posted on that, but for now, we begin with the activation of the state of emergency to give us flexibility to act on those emergency powers if and when it's necessary. Here's what else the City of Portland is doing so far. The Water Bureau and our Bureau of Environmental Services have suspended service disconnections during the state of emergency. That means they will not shut off water due to the non-payment of bills related to sewer, stormwater, or water bills. The city has decided to do this to ensure that everyone has access to the utilities they need to stay healthy and not worry for the time being if they're going through a financial hardship. We've also expanded community hygiene stations and portable toilets with hand washing stations across the city, and those efforts will be expanded. We're assisting shelter providers to keep winter shelters open on an extended basis, in addition to getting outreach providers more assistance and equipment, as well as increased motel vouchers for those who need it. On the economic front, we're working to help our small and large employers alike recoup losses from canceled events and loss of business and find additional financial support. I've also directed a team at the city to generate ideas for a stimulus package and will work with Prosper Portland to convene a COVID-19 economic impact task force to analyze other ways that we can be of help. We're also aggressively protecting the thousands of city employees and our visitors by postponing or canceling non-essential work gatherings, encouraging teleconferencing instead, stopping non-essential travel for meetings or conferences, and encouraging vulnerable employees to stay home for as long as they need to. So to wrap this up, COVID-19 has been jarring for every one of us, globally, nationally, and locally. The negative health, economic, and social impacts are and will continue to be significant. Nonprofits have already had to cancel their yearly fundraisers and therefore are struggling. Arts and cultural institutions in our community will be severely impacted. Small and large employers are already developing contingency plans. People are at risk of being laid off. I share this to tell you that we see, we hear, and we understand the anxiety and fears that people are expressing. But at a time when it is tempting to act out in a state of panic or fear, I want to say this loud and clear. All of us here, from the state to the region to the county to the city, we're working around the clock to make sure that your health and your safety are protected. That is our number one priority. We're making every decision with that priority in mind. Thousands of public servants are working tirelessly on this one purpose. You know this well. This is a rapidly changing pandemic. We will be frequently updating you as information becomes available. Portlanders have always looked out for each other, but now I'm asking you, particularly at this time, to help your neighbors who might need help. Thank you.
Thank you very much, Mayor Wheeler. As we've seen, as this global pandemic has evolved across the world, this virus does not discriminate. While we have 19 people who've tested positive in Oregon, we know that is just the tip of the iceberg, and there are likely hundreds more throughout our state. So I think we have to remember our thoughts need to go out to those individuals, their families and friends and communities as they recover. They need our support. They don't need stigma or misinformation to help them get better. So while we only have 19 people in Oregon who've tested positive for the virus that causes COVID-19, in looking at estimates from Washington and where Oregon is in our epidemic compared to our neighbors to the north, we estimate there could be 150 to 250 cases right now in Oregon. If we take projections from Washington infectious disease researchers and estimate a doubling of cases every week, which may be conservative, this could mean over 75,000 cases by mid-May in the state of Oregon without taking action. And so that's why our state and local officials are taking aggressive action today on social distancing. With the evolution of this outbreak, new guidance, looking at the estimates of what could happen here in Oregon, these measures are being taken so that we can build upon the individual measures we've asked people to take, including washing their hands, covering their coughs and sneezes, and staying home while they're ill, to put in measures that are more aggressive, that mandate the canceling of large events of 250 or more, look at those events that draw vulnerable populations, our older adults and those with underlying conditions of 10 or more, and canceling, working with our business communities, work sites, so that they can separate their employees and their customers to offer safety to everyone around them, working with schools to do what we can to assure that our students and school communities are safe while we try to keep schools open, because we know that education is incredibly important for students and the social connections at school. Certainly there's a tool for canceling schools as we look at the evolution of this epidemic, but we want to ensure that students and their families have access to this education, that parents can still go to school if they have essential jobs in healthcare and law enforcement and others. And so we don't take these steps lightly. We continue to look at the research and the effects of what we're doing every day so that we can see what do we need to do to help slow the spread of this disease in Oregon, protect Oregonians, and make sure that everyone has access to the high quality care that we offer here throughout the state. I'd now like to turn it over to one of my colleagues who's been arm in arm with us here working on this outbreak, Dr. Jennifer Vines.
Good morning, everyone. I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer, and I'm also the lead health officer for Clackamas, Multnomah, and Washington counties. I want to acknowledge that this situation has moved at warp speed, and public health has been keeping up as best we can, understanding that lives are on the line, and so are livelihoods. As we think about a virus coming through our community, it's already here. There is nobody immune to this virus. There is no vaccine. There is no treatment. The majority of us will suffer a mild illness. For those people, we ask you to stay home and not seek health care if you wouldn't otherwise. But some of us, in particular, are elderly, people with underlying medical conditions, are the ones we know are at risk of severe illness and potentially needing life-saving intervention at the hospital level. To the best of our knowledge and with the toolkit that we have in public health, the strategy of social distancing is one tool that we have, and I have no illusions about the bitter pill this is to swallow for our communities. You hear public health saying education is important, business opportunities are important, social connections are important. And unfortunately, we have to look ahead at what's happening in Washington and Italy, and we have to use the public health tool of social distancing as the best way, in our opinion, to try to slow the spread of this virus through our community, spread out those severe and critical cases so they can get the health care they need when they need it. You will see your local public health authorities shifting in strategy from focusing on individual cases and detailed contact investigations and follow-up. You will see us shifting now to supporting our health systems, to supporting our communities on what these social distancing measures mean for them. And you'll see us trying to do high-level health systems coordination to keep those services running. So again, I would call on all of us, let's tap into the creative energy and the spirit of community that I know is in our region. please be creative with alternative ways of coming together. Please look at our guidance, take it to heart, and by all means, keep in touch with your elected officials who care deeply about this situation and about the impacts on our community. Thank you.
So now we'd be happy to take questions. Just a quick reminder, we have hundreds of people who are viewing this through live stream. So in addition to your colleagues in the media, there are many concerned Oregon residents who are also viewing this. So what I'd like to ask you to do is to please introduce yourself, identify the outlet you're with, and direct a question to one of our local officials or health experts. And then I would like to ask the individual who's going to respond to the question to repeat the question so the people who are viewing this through live stream can hear the question. With that, here's the first question.
I'm Amber with KPTV, and regarding the large gathering here, does that mean have private events, maybe a wedding, large wedding area?
So the question is regarding the ban on large gatherings, would that apply to private functions like a wedding? Who would you like to direct that question to?
The answer is yes. The ban would include weddings. We're certainly asking people to take personal responsibility. If the wedding is 240 people, I would encourage you to make sure that the elderly and those with underlying conditions stay home. But obviously, we want our weddings and marriages to go forward.
And Governor, what is up there? I'm Elise Ross, I'm with 2016. In regards to social distancing, what does this mean for public transit? I know the time that's what
Do you want to talk, Pat? Do you want to talk? Dr. Seidlinger will answer that question.
So the question was, what does large gatherings mean for public transportation? The focus of the order on large gatherings is these organized events. But we know that we have workplaces and public transit where people come together. So we've been working with TriMet and other public transportation partners that they can increase their environmental cleaning, wiping down commonly touched surfaces, and if possible, implementing measures that would separate people in public transportation so they try and maintain at least 3 feet apart while they're riding to school or work or wherever they need to go.
I have a question for you, Governor. If things improve, I'm Rosemary from KXL Radio. If things improve in 2 weeks, will you lift the ban, or are you going to keep it in effect for that full month?
So for our live stream audience, the question is, will we lift the ban in 2 weeks if things improve?
Yes.
So we'll be making decisions moving forward based on recommendations from the CDC and public health professionals and medical experts. At this point in time, we are committed to the ban. Obviously, if things change in 2 weeks, we'll examine it. But any change in decision will be based on advice from local medical experts and public health professionals.
This is Hillary from Oregonia. A question perhaps for Dr. Seidlinger or someone else who could address when you might expand the testing rules for people who want to get tested to be able to get tested with your tests.
Thank you, Hillary. Hillary, I will let Dr. Seidlinger and Director Allen respond to that question.
The question is about testing and when will limits on testing be lifted at the state level. Currently, testing is becoming much more widely available for COVID-19, not just in Oregon, but across the country. The Oregon State Public Health Laboratory is committed to prioritizing those tests for those who are most seriously ill, so our hospitalized patients with viral pneumonia, for supporting our public health partners as we identify cases, particularly cases that may have some high-risk exposures or are at higher risk for complications. And as you heard yesterday, as we announced 2 cases in a congregate care facility for helping to assist testing, rapid testing in those facilities. For other individuals who have mild illness, we encourage them to stay home while they recover, as the vast majority of people will recover without needing any interventions. For those who do seek care, if they, with their doctor, agree that a test is needed that will inform the next decision-making, commercial laboratory testing is available, and many of our local hospital systems are also stepping up their efforts to test, and we anticipate those additional resources will come online soon. We updated our testing guidance from the OHA to clarify some of these things and did another push out to all of our providers so they have the latest information on testing here in Oregon.
Where did that 250 number come from?
I think there was some follow-up on testing first, and then we.
All on testing. So I'm Elise Hoskins, will we be able to be similar to Washington? I know that they're like, universities are helping step in and assist with processing those tests like UW, are we going to be doing something similar?
Again, we have many of our local hospital systems, including our academic partners, who are looking to step up this testing. And the Oregon State Public Health Lab is committed to assisting them to bring that testing up as quickly and efficiently as possible. And we know that our commercial lab partners have already stepped up and offered testing. So we're working on multiple fronts to try and increase the availability of testing for those who need it.
Additionally, following up on testing, which are the 5 hospital systems where it's now okay to conduct testing? Can you tell us when they began testing and what their capacity is?
We don't have any hospital systems locally who are up in testing. They're currently setting those tests up. They need to be validated. It's a long process, but the Public Health Lab is committed to assisting them, and as soon as they come on board, we'll let you know.
I don't know, what is the testing capacity currently?
Currently in our Oregon State Public Health Laboratory, we can perform about 80 tests per day. If needed to support the high-risk populations and our public health investigations, we can step that number up as the situation changes. The capacity in the commercial setting varies, and they're supporting our clinicians out in the community right now to offer testing, and we anticipate these additional hospital systems should be up and running in the next week, and that'll provide even more flexibility and opportunities to test here in Oregon.
One more question on testing.
Okay.
Doris from KGW. Just to clarify for everybody who's watching and for our audiences, people don't need the state's approval to get a test, right? Only if they're going to try and get a test through the state lab.
Correct. Our testing guidance, we're really prioritizing testing at the public health laboratory. Physicians who have hospitalized patients with viral pneumonia can submit that test online and don't need any approval from public health. Submitting that form and answering the questions is enough. Our local public health, tribal public health, and state public health partners are working with providers if there's a potential outbreak or a question about a case, and can approve those cases for the Oregon State Public Health Lab. For clinicians ordering tests in their office based on their clinical judgment, they do not need to contact public health. We do not need to give them approval. They can order that test. That test will be submitted. The provider will get the results to give to the patient, and state public health will receive those results as well, so we can assist in investigations.
There was a question earlier about the number 250 in terms of large gatherings. I made that decision based on the CDC guidelines after talking to medical experts and local public health professionals.
I have a question for you, Governor Brown. Dan McCarthy with K2 News. You had mentioned that school closures are considered a last resort. Is there a reason why they're considered a last resort rather than a preemptive move?
Yes, we're taking all appropriate steps necessary in terms of our schools. I know this is extremely difficult for Oregon families, but the reality is it's critically important for our children to remain in school, to get the education they need. Several schools provide both breakfast and lunch, and there are also in many of our schools we have local health professionals on campus. So we think it's critically important that our children stay in school as long as it's possible and safely available.
Governor, in the Seattle area, they've canceled a lot of churches, church gatherings, masses. Would you recommend that for, say, the Portland Archdiocese?
We're using that same number of 250. I understand that this is a hardship for many, many families. We would certainly encourage Oregonians to comply with the spirit of these recommendations. And there are other ways, I believe, through telephone, through more individual gatherings, and obviously through the internet for Oregonians to get the spiritual guidance that they need.
And another follow-up on the gathering. So she mentioned weddings, right? If there were to be somebody that, I guess, ignores that and still has a private event of 250 or more, is there a penalty for that?
There certainly is a criminal penalty, but the harsh reality is we need our public safety and our public health personnel to be focused on containing the virus and making sure that we have the capacity we need to address the needs of the virus.
Does this include outdoor gatherings too, like Portland Saturday Market or some large term plaza or anything like that?
I'll let Director Allen speak to that.
Patrick Allen, Director of the Oregon Health Authority.
The guidance in outdoor events is really around the ability to achieve social distancing, separation of people. If an outdoor event is able to maintain that social distancing, then it would not fall under the under this guidance. If they can't, then it would.
So what about the example of Portland Saturday Market?
That's one that we're going to have to see how it plays out in practice. I can imagine circumstances where it can be very difficult, and I can also imagine where it can be managed, and we'll work with them to see how that develops.
Hillary's an Oregonian. At the Veterans Home, has everyone been tested at this point for COVID?
Yeah, thanks. The question was, has everyone at the Oregon Veterans Home been tested? We deployed an infection control and testing strike team last night to the site. No, everyone has not yet been tested. It's a fair number of people, and so we're working through a priority process of patients, close contact staff, those kinds of things. And we will test all of the patients and staff in the facility. It will take us a little bit of time to accomplish that.
How many people is that?
1 second, and I can tell you that. That's 151 residents, 225 staff, and others.
Director Allen, Helen Jenner with Oregonian. What new information triggered this change in response? You know, what, I guess, made you realize that the previous approach of telling people to cover their cough, et cetera, wasn't working?
Well, of course, we're continuing to tell people to cover their cough and sneeze and stay home when they're sick, because that continues to be the very best thing people can do to protect themselves and others from the disease. Yesterday was a confluence of a variety of events. We completed the analysis that Dr. Seidlinger talked about in terms of estimated future cases by May 15th, something on the order of potentially as high or higher than 75,000. The World Health Organization made its pandemic decision. We also became aware of a variety of individual decisions that were being made across the state about cancellations and those kinds of things. And really only the governor has the ability to establish and enforce an order. And we thought that was far better than a whole bunch of individual decisions kind of scattershot across the economy.
Director, just circling back on the Veterans Home, can you say how long it's expected to take to complete the testing there? And perhaps for your Dr. Seidlinger, why are you not expanding the testing that you're doing with the CDC test at the state lab?
Yeah, so I'll try to take both, and then Dr. Seidlinger can correct me if I get it wrong. I don't have a specific estimate. I would expect that we can gather the samples over the next couple of days down there, but I'll verify that and make sure that's the case. The reason we're not expanding the criteria at the state lab actually is to preserve the capability to do exactly what we're doing at the Veterans Home. We want to have that capacity to be able to do those critical kinds of incidents and be able to go in and provide a surge capacity to be able to accomplish that testing. We think that the everyday testing that can go on through the commercial labs and ultimately through the hospital systems should be the production level of testing. That's the way most tests for most diseases in the state work, is that regular labs do that work, and the public health lab is really intended as a special purpose safety net testing facility, and we want to preserve that capacity.
Beyond testing, what's happening we could just talk a little about the situation at the home in Lebanon. I mean, what's happening there, what's happening with the residents, the staff members?
Sure. So the team is also, the question is what else is happening at Lebanon. The team that went down there, in addition to collecting samples for testing, is also focusing on assessing the infection control capabilities and practices at the facility, and then providing other assistance that facility identifies that it needs to manage the circumstance. I've not been down there myself, but what I've been given to understand is this really is a state-of-the-art facility that has already been practicing state-of-the-art practices around infection control. They have individual rooms for each person. They've got the ability to create negative airflow in the room so that the air is not circulating from one room to another. They're establishing what we call staff cohorts, where staff who are tending to those who are sick are not the same people as staff who are attending to those who are well, so that minimizes infection. They have and are doing absolutely everything we could have asked them to do in a circumstance like this.
Governor, a political question, will this postpone your special session?
Pat's question was, will this postpone a special session? I know that legislative leadership are talking. I spoke with both Democrats and Republicans yesterday. I actually think that legislative leadership on both sides of the aisle wants to make sure that we have the adequate resources that we need, and should a special session be needed to ensure that OHA and local public health authorities have adequate funding, I'm sure that they will come together around that.
Governor, earlier this year, you guys have been looking at the state level, spending as much as $500 million, that you're getting these good revenue forecasts. With the economic outlook changing, does that still seem like a good idea?
Hillary's question is, we have roughly $1 billion in reserves right now. I don't know what the total of expenditures would have been should the budget bills have passed, probably roughly in the neighborhood of 400 to 500 million. I would just say, I think there are some still dire needs out in our communities around Oregon. We were able to get the $11 million funding package for the Umatilla Basin recovery package done. I would certainly argue that fuel reduction still needs to be a priority. Much of the state is in drought, and there was $21 million on the table that would have been boots on the ground in rural Oregon for fuel reduction, thinning, and prescriptive burning. I would argue that that is still a priority. Obviously, we are watching the economic forecast and the economic situation very carefully. We have a large number of resources in reserve in our stability funds, and we will be very prudent fiscally moving forward.
My name is Tessa. I'm from Modesto. I'm wondering, Governor, why has it taken the state 2 weeks to implement commercial testing in hospitals?
I'm going to let Dr. Seidlinger respond to your question.
The question was, why has it taken 2 weeks to set up testing in commercial laboratories? Let me say that our federal partners have been working very hard to try and expand the capacity for testing. Initially, the Centers for Disease Control and Prevention with the Food and Drug Administration developed the test that tested the initial cases in the CDC laboratory. They quickly pushed out a test to state public health laboratories and large local public health laboratories to expand that capacity. There were some quality issues with those initial tests, so they were put on hold while those were worked out and assured that they were performing as they should. Currently, I believe all 50 states have their state public health laboratories up, with many of the large local public health labs continuing to do testing. That testing in most places is really focused on getting the people who are most at risk and the people most at risk for complications tested. The federal government also worked very quickly in a system that often takes a long time to set up testing in the commercial settings. That can often take a lot longer than these public health labs stepping it up, and they put out emergency use authorizations as they did with state public health labs to these commercial testers, and it depends on their ability to do those tests. There's many things that are involved in doing that test. People focus on the CDC test kit, and that's one aspect of it, but there's other things that the labs need to do those tests, many of which are in short supply, so all commercial labs are working to ensure that they have the supplies they need, from collecting the swab to issuing the test result to get those out, and I think they're working very hard to get those up, and that's, they're working directly with the federal government. We are at the state where we have the control and the power to be able to help, we're doing that, and that's where these 4 healthcare systems will be coming up, because we want to work with our partners to ensure that testing capability is available to support all those who need it, and to support our healthcare partners in offering that test to those who need it.
Certainly, I would appreciate the capacity to have more testing, but my understanding, at least according to public health professionals, is that we have an adequate amount.
Then I have follow-up questions either for Mayor Wheeler or Chair Kafoury. Are you guys going to continue doing open public council meetings at this time?
That is under consideration. We're taking into account the distancing requirements that have been suggested by public health authorities, and that's currently under evaluation. We have not yet made a final decision on that. Oh, I'm sorry. Thank you. The question was, are we going to cancel city council meetings or restrict public access to council meetings or implement social distancing requirements? At a minimum, we will implement social distancing requirements, but everything's on the table.
I have a question for one of the doctors, Rosemary KXL. At what point would you say we have to reach before you would make a decision that people need to stay home, children shouldn't go to school?
You know, I think we've been talking about schools. We plan around schools for potential pandemic influenza outbreaks and other things because we know schools are an important place that can help spread that disease. So even before our first case here in Oregon, we talked about that. With our first case having some contact in schools, we put that into action and worked with our school district partners. Local public health and school districts work together all the time on investigating outbreaks and keeping people healthy. So we will continue to look as cases come up, see what contacts there were at school, see what actions needed to be taken at that school to make sure that people are healthy and safe. Strong messaging about excluding people who are sick and updating our rules so that those students, those faculty, those teachers can be excluded from school and stay home so they don't make others sick. And this will continue to evolve. We'll look situation by situation, but weighing everything that's going on right now, weighing the impact on kids, weighing the impact that school closures could have on the broader health of Oregon, you know, we are making the decision to keep those schools open. And, you know, we'll continue to evaluate that. I can't give you a hard number or hard percentage, but we look at all these cases and we take our exposures in schools very seriously. And I don't know if Dr. Vines wants to add.
Thank you. To the question of how will we know if we've reached a point around broadening the social distancing recommendations, in particular closing schools. I would just add to what Dr. Seidlinger said, that the difficult decision-making for our elected officials and for those of us in public health is that if we start seeing crowded emergency departments and full intensive care units, by then it's too late for these social distancing measures to have much impact. So that is the very difficult decision-making that everyone in the room and a lot of great people are working on right now to try to understand the implications. What would it mean for our healthcare workforce? What would it mean for families? How would people eat? How would people still go to work and pay their rent and buy groceries? So these are, as you are clearly understanding, these are incredibly complex questions, and we are grappling with this actively. Again, everything is changing so quickly. I agree with everything Dr. Seidlinger said, with the caveat that, again, I can't predict where we'll be in the next few days.
If I could just add, I'm not one of the doctors, but if I could add a little bit, you asked about advising people to stay home. I just want to emphasize the CDC has said, and we agree that, and we have already said, if you are in the at-risk population, older Oregonians, people with underlying health conditions, you should stay home as much as possible. That's absolutely our guidance today to people. You should stay home as much as possible. We can't emphasize enough how dangerous this is for people who are at risk.
So when I was just circling back on testing, can anyone here tell me today what the private test capacity is numerically just at this moment? I know it's probably changing quickly.
I cannot talk about the public, the commercial testing that's available within our Oregon Public Health Laboratory. Again, we can test about 80 a day with the capacity to surge up. For the commercial capacity, that would have to come from them.
Can you clarify what you mean by commercial capacity? Is this like Quest Labs, things like
So
that?
currently LabCorp, Quest, and many other the national providers that support a lot of health systems, a lot of outpatient clinics and doctors' offices have offered this test, and they're working rapidly to expand it. So those numbers would have to come from them and their
Is
capacity.
that not an important piece of information for Oregon's response to this situation? Like, who would be the person where I could get that information from?
Again, if you want to talk to what is LabCorp's capacity, I would suggest talking to LabCorp. Right now, what I can say is that we have adequate capacity in the Oregon State Public Health Laboratory to support our public health infrastructure and identifying those cases who are most at risk for complications. Those cases are most at risk for the disease, and in situations that, as Director Allen said, to investigate potential cases in a congregate care setting where we need to act fast. So we have that capacity. We will continue to expand that capacity as needed, and the commercial capacity is coming up, and if you want to know the exact numbers, you would need to talk to them.
Chair, did I hear you right that you said there's drive-through testing in Multnomah County?
No, sorry, thanks, Pat. Asking about the drive-through testing at Multnomah County. We did, in conjunction with the Oregon State Lab, we did a emergency testing last weekend with the drive-through capacity. But it was in the same number of tests that are available through the state.
I had a quick question regarding Animal PPTV again. A lot of people upping their personal hygiene to the point where like hand sanitizers and wipes are sold out in stores. Is the state working with manufacturers about restocking things like that, or is that something that you guys don't do? I'm not sure who I would be.
Yeah, I'll take a shot at that and invite others to bail me out if needed. There are shortages of lots of things like hand sanitizer and those kinds of things, and they're not just shortages in Oregon, they're not just shortages in the United States, they're global shortages. This circumstance has been compounded by the fact that its epicenter is in China, which means the demand in China has been huge. Much of these materials are manufactured in China, and so they're tending to divert that manufacturing to their own use. And then the manufacturers themselves in China have been significantly disrupted. And so it's a huge demand issue as well as a supply chain issue. And it applies not to just hand sanitizer, but all kinds of other things that we will need in this circumstance. We have a stockpile that we're able to distribute to healthcare providers and other critical pieces of the healthcare infrastructure. There's a national stockpile that we have the ability to access, and we are accessing. But these shortages will continue and may become significant despite the efforts of the federal government to have private companies ramp up production.
A question about incarcerated.
Sure.
Is there specific guidance for those that are incarcerated where social distancing may be very difficult, or staying home is really
Yeah. So the question is, what about people who are in custody? And yes, we are working with corrections to tailor some of these recommendations to their environment. They do already have protocols that they implement around influenza and other infectious disease, and so the protocols themselves are not necessarily dramatically different than that. We're working with them on a visitation protocol similar to what we've done with congregate care, and so there's some tailoring that needs to be done, and they're challenging in a corrections environment because some of these things that need to be trimmed back or done differently are themselves part of how corrections work smoothly, but we're working actively with them on that.
They say they're sort of waiting for a case. It's not a matter of if, it's a matter of when.
Oh yeah, no, I talk regularly with the Director of Corrections, and I can assure you they're not waiting for a case. They're working with us right now on the steps they need to take.
Just want to add two things. Number one, I know that there was a recipe floating around for making your own hand sanitizer, but Dr. Vines reminded me that soap and water, as long as you are using it properly, are extremely effective and the best tool that we have. I also wanted to add, we are concerned, frankly, about our testing capacity, and we are working with our federal partners and HHS. However, the federal government is the only one who can expand our testing capacity, and we are calling on them to do that.
Governor, we heard from Dr. Vines
All right,
about how
excuse me.
fast things
Why don't we
are
take
changing.
2 more questions?
And we certainly hear that from the public, people saying, I can't believe how fast things are going. I wonder what it's been like for you and how difficult was the decision to make this historic change?
Well, Pat, that's exactly right. We all know we have not seen anything like this in our lifetimes, and all we need to do is look around at what is happening around the entire world. For me, my heart goes out to the families impacted by this disease. I'm obviously extremely concerned. Our focus, my team's focus, is on keeping Oregonians safe and obviously keeping the economy humming. And so we're going to do everything possible that we can. But it is, as you know, it's certainly been a roller coaster. There's no question about it. We appreciate what I've been very grateful for is the collaborative efforts. Chair Kafori and her team are here. Mayor Wheeler is here from the city of Portland. We've got legislative leadership on both sides of the aisle. I know they have our backs, and I've been on the phone regularly with our federal delegation, Senators Merkley and Senator Wyden, and frankly just had an opportunity to talk to Robert Kadlec, Dr. Robert Kadlec at the CDC this morning, talked with Secretary Azar yesterday. They are working hard to meet our needs, but we just need to work harder and faster. That's the reality.
Governor, at a high level, whether it's testing capacity or these guidelines now for mass gatherings, do you feel that the state is in a better place in terms of the response than we were a week ago?
Yes, I am making decisions based on the best information available to me at the time. We are relying on public health professionals and medical experts in making these decisions. Director Allen talked about the transition, the information from the CDC, the Centers for Disease Control, earlier this week was helpful. I had an opportunity to connect with Governor Inslee yesterday. That was helpful. And yes, this disease is evolving. We are making decisions as quickly as possible and with the public interest in mind, public health and safety in mind.
So is that, yes, we're in a better place in our response than a week ago, or?
Look, we are making the decisions we need to make at the time we are making them. For example, I issued an executive order on Saturday night at 8:14. I made that emergency declaration on Saturday because my public health professionals told me they needed additional resources, funding, and additional tools and additional personnel, and that emergency declaration gave them what they needed at that time. So the answer is yes.
All right, thank you very much for coming.
Thank you.